Good day to you wherever you're listening from. Welcome to My Health, My Life, the program where your well-being takes the center stage. This is the space where we talk honestly about our bodies, our minds, and the everyday choices that shape the quality of our lives. And this is because health is not just about avoiding sickness, it's about understanding yourself, listening to your body, and learning how to live better, stronger, and even happier. And every week on this program, we bring conversations that inform, inspire, and empower you to take charge of your health. So wherever that you're listening from, at home, at work, on the road, I tell you that please settle in, because today's conversation could change the way you think and even open your eyes to see that there are some things that should be done and there are some things that are quite important that should not be overlooked, and your health and your life is quite important. The voice that you are listening to is the voice of Boluwatife Helen, your sweet radio voice, and I welcome you to the show. Okay, so My Health, My Life has every Tuesday afternoon, 1 p.m. UK time and 2 p.m. Nigerian time, and you can listen to me live on www.moreradio.co.uk www.moreradio.co.uk. And moving right into the business of the day, like you know that on the show we always have two segments. The first segment is where we either debunk a myth if it is false and claim it as true if it is actually true. And the second segment is where we dive right into the discourse of the day, the conversation of the day. And like I say every time that I'm on this hot seat, like I call it, and behind this mic, that everything that I bring to the show, every conversation, every discussion that we have on the show is quite important, because if they're not even important in the first place, I won't be bringing them here. So I brought everything that is quite important for us to know about our health, so that we can live a very healthy life and be happy and even live stronger, so that we'll be able to do our daily activities well and without no issues. So today again, I have brought these topics for us to discuss. So moving into the first segment of the show, I already have that myth with me in the studio today, and this myth is something that we have heard over time and we have been made to believe that it is true. Well, maybe because they are just trying to use it to caution us to stop some things, or maybe because they did not know better. I mean, our parents or the elderly ones at that point did not know better, or maybe they just want to scare us off some things from doing that particular thing. And what is this myth that I've brought today? The myth is that the idea that drinking cold water causes pneumonia is a myth, because they tell us that while growing up, several times I was told that don't drink cold water so that you'll not come down with pneumonia and all of that. This is not actually true. This is a myth and it is false. Pneumonia is not caused by cold water, drinking cold water, or because of the cold weather or what have you. Pneumonia is actually an infection of the lungs, and it is caused by microorganisms. They are not caused because of temperature of a drink or of the weather or something. Pneumonia is caused by microorganisms, and the microorganisms or the disease-causing organism is infectious agents like the bacteria, the viruses, or even the fungi. So it is these three microorganisms that cause pneumonia. These germs, they can spread when an infected person coughs, sneezes, or talks, because when they are doing all of these things, at that point they have released droplets into the air, and when these droplets have been released into the air, they can be inhaled by others. So it's not because we are drinking something that is cold or because of the temperature of what we are drinking, maybe water, maybe any kind of drink or all of that. No, it is because somebody that is already infected with this pneumonia has sneezed or has coughed or is even talking, and the droplets that have come out from this person is, of course, it is airborne. It travels in the air to another person that has not been infected, and it infects that person. And some other things that will make one infected with this airborne disease, because once the droplet drops from the infected person and it comes to the uninfected person, is that maybe the uninfected person has a weakened immune system. Maybe the immune system of that person is weak, and the conditions like chronic illnesses, immunosuppressive medications, or even age-related immune decline can cause somebody to be at risk of pneumonia. So if your immune system is not strong or is weakened, and the droplet from an infected person finds its way to you, then that person can come down with pneumonia. And also, we talk about infections. It's an infection actually, and these viral infections like the flu can predispose individuals to secondary bacteria, because you already have something that you are dealing with in the first place. You already have an infection that you are not in the first place. Then this infection is caused by viruses because it is viral, so it is caused from viruses. It can open the door down for the pneumonia caused by bacteria to come in. So you're already infected with virus now open the door for the pneumonia that is caused by bacteria to come in. You know, we said that it can be bacteria that will cause pneumonia, it can be virus, it can even be fungi that will cause pneumonia. So maybe you already have a viral infection, that infection that is caused by virus, then the bacterial pneumonia now comes right in as a secondary body. Now also, if that person is already tackling with some chronic disease, maybe asthma, maybe pulmonary disease, or even heart disease, because you already have a chronic disease, you are susceptible to coming down with this pneumonia because you're already battling something. Your immune system is weak. And also, for the people that smoke, we cannot overemphasize the need for people to stop smoking. Smoking does not do anything. It doesn't have any usefulness to the body. So people that are smoking, they are at the risk of coming down with damaged lungs. And when these damages are made to their lungs and their body ability is impaired and is not able to fight off respiratory infections, that person can come down with pneumonia. We said pneumonia is an infection of the lung. So imagine that person, that smoker's lung is already damaged in the first place and is now coming down with an infection of the lung. I mean, it's just that one is already there, another one is coming. And pneumonia actually is not something that should be overlooked or just be discarded as is a little thing. No, it is not a little thing. Pneumonia can actually kill if not taken care of. And also, some people that are in the hospital, when you are in the hospital, especially intensive care units, there is exposure to various pathogens, because at that moment, people have come to the hospital to treat so many illnesses and so many infections, so many viruses, bacteria, microorganisms are in the air flying around. So many airborne diseases can be picked up. So if you are in the hospital or you constantly stay in the hospital, it's possible for you to come down with pneumonia, because at that point you are exposed to various pathogens. And the basic thing is just that once you notice any effect or anything that is so unlike you, any unusual feeling in your body, quickly go to your healthcare provider so that you can complain these things. And when you know that, okay, when they now diagnose you and say that, okay, it's pneumonia, they will be able to treat and you'll be able to be better. So this is the end of the first segment of the show. If you're just joining us, this is My Health, My Life, and I'm not so happy to tell you that you have missed the first segment of the show, where we debunked the myth that drinking cold water or anything cold causes pneumonia. We said that pneumonia is actually an infection of the lungs that is caused by microorganisms like viruses, bacteria, and even fungi. So it has nothing, absolutely nothing to do with temperature. So don't think because you are drinking something cold or something, fine, you shouldn't take much of cold things, but then not because of that you come down with pneumonia, and because you've been told that for over how many years in your life. I mean, the bulk of your years in life you've been told that, oh, don't drink something cold because you can come down with pneumonia and all of that. No, this is just to correct that notion that it is not the temperature of a drink or something that causes pneumonia. It is actually viruses, bacteria, or fungi, microorganisms that cause pneumonia. So now it is time to dive into the second segment of the show, and this second segment is where we have the discourse of the day. And the topic I have on the table today is something that we are familiar with. We are so familiar with, and we cannot overemphasize this topic. We just have to talk about it, we just have to discuss it, we just have to create that awareness, we just have to discuss it. And what is this topic that I have with me in the studio today? Well, the topic I have with me in the studio today is stroke. Yes, stroke. 6-letter word, but very mighty health condition. Stroke is a fatal medical emergency. Emphasis on fatal. It's a fatal medical emergency that is caused by interrupted blood flow or ruptured vessels. So if there is no enough flow of blood to your brain, or the veins that are carrying blood to your brain has any kind of rupture, or it bursts at any point, it can cause stroke. When it's anybody that has stroke or something, it means that the blood flow to that person's brain is not going well. Either it has been interrupted at one point, or the vessels that are carrying blood to that person's brain has been ruptured, or it has burst. That is why that person is suffering from stroke. And when blood flow to a part of the brain is blocked, if not entirely the brain, well, maybe one part of the brain, and the blood cannot flow to it, it can cause so many bad things, and one of it is the stroke that we've just talked about. And when the brain does not get oxygen, the cells in that part of the brain begins to die within minutes. It doesn't take long, because oxygen in the blood is what is keeping them. It's what is keeping them active to do their daily functions and all of that. So imagine that there's no blood in that side, there is no oxygen, they will not be able to live. That is literally what they are living on, what the brain cells are living on. So when there is maybe interrupted blood flow, or the vessels there have bursted and all of that, because of that, blood is not flowing to the brain like it should. The cells, there's no oxygen for them to perform their activities. The cells there die, and when they die, that person comes down with stroke. And stroke is a medical emergency. And if the brain cells in that area die, the damage is a very permanent one. It becomes permanent, and this can cause permanent disabilities, or it can cause changes in how the person can use the body, because at that point, everything that the body is supposed to be doing at that point, the body will not be able to do it. When the blood flow is restored in that part, it can prevent that permanent damage or reduce the severity of the condition. So in a way or two, that's why I said medical emergency. Once you know something like that, quickly contact your healthcare provider so that they can know how they will be able to do it. So if you're around any person that you notice something like, okay, the person is coming out with stroke and all of that, if they are quick to restore the normal blood flow of that part of the brain, yes, so it can now prevent the damage or reduce the severity of the condition of the person. That is why time is very critical when treating stroke. So what are the symptoms that somebody that has come down with a stroke will see? Now, symptoms of stroke depends on which area of the brain is affected, but some of the most common symptoms include the person will have trouble speaking, or there can be complete loss of speech. There can be blurry vision or even double vision. The person will not see well, their visions will be blurry, or they are going to be seeing one person as two. So at that point, that person is going to be confused or even agitated. Some people even fall into coma. Some people are going to be dizzy, they are going to feel dizzy, they have headaches, usually the kind of the one that is sudden, but as it's sudden, it is severe. So it's two-way thing. The headaches are coming from nowhere, it's sudden, and it is severe, that they'll be complaining that, oh, my head is aching me and all of that. And there's loss of muscle control on one side of the face. Once there is something wrong with the brain, that part of the brain, there's loss of muscle control, there's loss of coordination, there's clumsiness, there's memory loss. Those are the symptoms that you see in somebody that has come down with stroke. They may not be able to remember you, or even remember something that you've told them now. They may not be able to pick things like they used to, things that they can remember within minutes, within a split second. It will take them time. In fact, you might even be the one to tell them something out of it, just to trigger them. Oh, did you remember I told you this? at that point you'll be like, oh yes, I remember. And you were saying, and at some point you notice that they cannot complete that sentence. That's because they had lost their memory at some point. If not everything that you told them, at least the one that you reminded them is the one that they can remember. And you will not be surprised if you have to tell them again that, oh yes, I told you this yesterday, I'm telling you again, because that person has memory loss. Also, there's mood swing or sudden personality changes. Somebody that is lively, that is jovial, you just notice that to even talk, because they are finding it difficult to talk, they are not able to behave like they used to. So there's mood swing for them. They have nausea and they're always vomiting. There's neck stiffness. They will not be able to move their neck like they should. They can pass out or even faint. They can have seizures. They can have slurred speaking, and they can have sudden worsening or loss of senses. So their visions, their hearing, their smell, their taste, and their touch can be tampered with. All of these, their senses, can be tampered with. They can experience weakness or even paralysis on one side of their face and even their body. So stroke is something that in fact, it is life-changing. Imagine that somebody is jovial, active, and all of that, and the person that comes down with stroke, and at that point they are not able to move their body like they used to. They are not able to behave like they used to. Somebody that is jovial, now they have mood swings. They don't want to talk too much. They don't want to, just leave them. They just want to be alone because they have trouble speaking. Even the one that they want to speak, they can't speak it very well. Even the one that you told them yesterday, somebody that they'll be the ones to remind you that, oh yes, you told me you want to do this. Have you done it? Now it is now you that is not saying it more than one time, telling them that, oh, I told you this, I told you this. In fact, you may tell them now, the next minute they are forgotten because they don't know. At that point, they are suffering from memory loss. And if you are close to somebody and you see some changes in them, please be quick to recognize these changes. And how can you recognize these changes? There's an acronym, FAST. FAST. And what is the F? You notice their face. Tell them to smile. Try to get them to smile. When they smile and there's a droop on one side or both sides of their face, note that yes, that person has come down with stroke. And the hair part is their arms. Once they raise both arms, they try to raise both arms, and if it is somebody that is suffering from stroke, one arm will sag or drop in a way that it usually doesn't. So if you know that you tell them to raise their hands and they cannot raise it properly, one hand is sagging and the other one is standing straight, or even both hands cannot be raised properly, then their speech, that is S in fast, the person might slur in their speech or have trouble choosing the right words to say. Time is for T in fast. Time is really critical when you are dealing with stroke, because you need to call for help immediately. We're talking about brain here. There is no flow of blood to the brain. There's not enough blood to the brain. So if it is interrupted, that means that there's not enough flow of blood. And if it has burst, it means that there's no flow of blood to the brain. And that part that there's no blood, there's no oxygen, the brain cells die. So you can see the severity of these things. So if you don't call for help immediately, they can shut down. And that is why some people enter into coma. They can actually shut down their brain, and once their brain shuts down, their whole system has shut down. So if it's possible, you can just look at your watch or your phone or your clock just to trace when the symptoms start. So when you're talking to the healthcare provider, you can be able to say, oh, this was when I noticed this and all of that. This was when I noticed this. If it's maybe your friend or your family member or something, so that you'll be able to tell the person. And if it is you may not be able to do much. You just need somebody that will be there for you to just be able to monitor these things when something is actually going wrong. And there are different kinds of stroke. The first one is ischemic strokes. This one happens when blood clots, or when there is this clot that blocks the blood vessel connected to the brain. This one is the kind of one that has interrupted blood flow because something is blocking it. A clot has formed that is standing in the pathway of the blood because something is like a stumbling block on that path for the blood to go through. That is why the blood is not going to where it's supposed to go to. So that one is ischemic, and this clot can be caused by arteriosclerosis. That is that the walls of the arteries have been hardened. There are plaques, there are droplets of some things on the walls of the arteries that blood is supposed to pass through. So at that point, there is clotting disorders. Heart defects can cause these ischemic strokes. Also, there is hemorrhagic stroke. How this hemorrhagic stroke happens is when there is a rupture or a burst in the blood vessel. This one is caused by the second one that we talked about, that okay, because that blood vessel has burst or it has ruptured at that point, or it has broken at that point, there's a break. Instead of it to go straight, it is leaking at some point. That one is uninterrupted, nothing is blocking it. In the part of the ischemic one that something is blocking, if there is a surgery or something to take away that one that is blocking it, it can keep going. But in this place, there's a break in that vessel that is taking blood to the brain. Something has ruptured, something has torn at that point, and the blood is not able to go to the brain. And what can cause this is brain tumors. High blood pressure can cause this. Moya disease can cause this hemorrhagic stroke. Then the third one I said there is transient ischemic attack. Now this transient ischemic attack, it is sometimes called mini stroke because it is like a stroke, but the effects are temporary. It is not like the permanent damage that we talked about earlier. This mini stroke, the effect of this mini stroke is temporary. It's just like a warning sign, so that person can know that something is wrong with your body system. It just comes like that. It's like warning the person that you need to take your health seriously. And when these warning signs come to that person, the person is at high risk of coming down with true stroke soon. And the people that are at risk of coming down with stroke are the people that are older than 65. Normally, when the body is growing older, there's tendencies for it to come down with some kinds of diseases because it has grown weaker. For people that smoke, I said it earlier, smoking has nothing that it is doing. In fact, it's doing more harm than it doesn't have any good to the body. So people that smoke are at the risk of coming down with stroke too. People that use recreational drugs, unprescribed drugs, you just take drugs at will, it is possible that you come down with stroke. And anybody that thinks that stroke is just for old people, of course it is majorly, but then because of the lifestyle of the younger ones, they can come down with stroke too. And when somebody has underlying medical condition, it can increase the chance of coming down with stroke. Alcohol disorder, you just drink anyhow, you cannot stop drinking, or you cannot cut down on your drinking alcohol. You need to cut down, because if you don't cut down, at some point you're at risk of coming down with stroke. People that have frequent migraine headaches, if you know that most time we talked about sudden and severe headaches, you better see your healthcare provider. People that have underlying health condition like high blood pressure, you that are nursing high blood pressure, you need to be careful because the risk of coming down with stroke is very high. People that have high cholesterol, you need to be careful too. You're on this table. People that have type 2 diabetes, you also need to be careful. So basically, because of these underlying health issues, there's tendency of coming down with stroke. And stroke can actually be treated. For people that have bleeding strokes, surgery can be done on it. But the earlier treatment starts, the better the outcome. So you better see your healthcare provider anytime you notice any changes in your body. And if you are not seeing any of these underlying health conditions, you shouldn't be far to your healthcare provider. And when stroke is treated, recovery may include you going for physiotherapy, speech therapy, lifestyle changes. You can be placed on medication so that you can recover, and you can recover fast. And some people actually recover fully, but some people always have this disability that they live with for life. That's why I said stroke is very dangerous. It's a very dangerous one. And the way you can prevent you coming down with stroke is that check your blood pressure regularly. Just going for checkups. If you notice anything in your blood system, if you notice anything unusual in you, that you don't feel this way, you're active, something is wrong. We talked about the fast. You feel that your face at some point, when you smile, the side of your all sides of your face is drooping and all of that. We talked about your arm, you cannot lift your arm. Talk about your speech. If you notice anything like that, just go see your doctor. Then you need to reduce your salt intake. Stop consuming too much salt. Exercise at least 30 minutes daily. Eat fruits and vegetables. We cannot overemphasize that one. I say it almost every time. You need to eat balanced diet, and your food cannot be balanced if you are removing the fruits and vegetables from the part of your food. No. So you need to eat fruits and vegetables as you eat your rice, you eat your beans, you eat all these cereals and all of that. Eat your fruits and vegetables like that. Stop smoking. Smoking has nothing that it's doing. Limit your alcohol. If you can stop alcohol and smoke, in fact, it's very good. But if you know you cannot stop alcohol, maybe you drink like 5 bottles, reduce it to 1 or 0. Then maintain healthy weight. Make sure that you don't have high cholesterol in your body. Manage your stress properly. I mean, if you know you are the kind of person that stresses and all of that, everybody stresses. So make sure that as much as you are stressing, plan a day or something to just take a break from everything. Sleep well, manage your stress, do something that will help you renew your mind and your strength. Anything that works for you. Some people is cooking, some people is sleeping, some people is reading, some people is relaxed. Everything that will make you relaxed so that you can manage your stress, just do it. Too much stress can make you fall into that pit. Take your prescribed drugs or medications consistently. All these small daily habits can help save your life and can make you live a healthier and happier life, because your health is your life. So this is going to be all today on My Health, My Life. Until I see you again on Tuesday, stay informed, stay healthy, and take care of your health and your brain. My name remains Boluwatife Helen, your sweet radio voice, and I wish you wellness every day. Bye bye.